Well, it is always a good time to talk about heart health. According to the CDC, heart disease can happen at any age. Half of all Americans have risk factors that can endanger their health. And February is, of course, American Heart Month. And it's a good time to learn about your risk. And to tell us more about this, joining us, we have Dr. William Salerno. You are a cardiovascular disease specialist from Hackensack University Medical Center. So first of all, welcome. Thank you so much. So the first question is, who should be checking their heart? What age should this be happening?
So I think if you're an adult, that's number one. Number two, if you're old enough to have children, you're also responsible, because you have to remember that there's 40 million children in the world that are either overweight or obese. So it starts in the youth, and it continues there on. The American College of Cardiology, the American Heart Association has 7 simple steps on how we can all take part in taking care of our own health and taking ownership in it. So simple things starting first: diet, exercise, weight control, no smoking, and that means anything, and then blood pressure control, and then in conjunction with your physician, cholesterol measurement and your sugar control.
Okay, so a lot of those things are things we should be doing daily.
Right.
Now, we did in our intro, we talked about risk factors for heart health concerns. So what are some of those top risk factors?
Well, smoking is probably the most important thing. And now with the legitimization of other forms of smoking, especially for our young kids, and burning products that are even legalized, I think that's a whole nother thing that we have to deal with across the world. And number one, heart disease is the #1 killer in the world. Close to 18 million people a year are dying of that. In the United States, it's #1, and it's the #1 for men and women.
Okay, and we have a list of factors that are concerns. I think obesity is another major factor. Would that fall after smoking for concerns?
Sure.
Or we have our risk factors here we can go through. So we have obesity, that's a major concern. Diabetes?
Yeah, so they go hand in hand, and you have to remember that, unfortunately, in the United States, 65% of us are either overweight or obese. And, you know, you can go on the American College of Cardiology's website, look at your risk factors, and there's a calculator available, see what your body weight is and see what your risk factors are, and then decide in conjunction with your physician, do you really want to take aggressive steps in changing those risk factors? And you can.
So if you do have concerns, or even if you don't, you should get tested.
Absolutely.
So what are some of those most important screening tests?
From a physician point of view, having your blood pressure checked regularly, but now with these digital blood pressure cups that are available for anywhere between $80 to $90, and they're fairly good, you can check and take ownership of your own blood pressure, remembering that we changed things in 2017. The top number, the systolic pressure, 100 to 120, the bottom pressure, the diastolic, 60 to 80, that's your blood pressure for life. If you take ownership of that and check it, it helps, because basically when you go to the doctor, you'll always get pushback because no one wants to take medicines. But if you have high blood pressure, you have to treat it.
And then what about cholesterol? That's another big one we hear about.
Again, we've legitimized numbers that are higher than we probably should, simply because there's not a lot of people that have good cholesterol. So changing the norms just to accommodate that is probably not a smart thing. If you look at populations that are more plant-based and have much lower cholesterols, there's a much lower incidence of heart disease. So we should really take heed to that and try to get more into a plant-based protein diet into our nourishment. And that's a little bit difficult, so it should be done in a stepwise process.
So the key is getting checked. And then the next question is just how often should we be doing these tests? And what about the body mass index screening? How important is that as well?
So the body mass index is fairly simple. I mean, there are a few calculators online, easily accessible to everyone. And you want to keep your body mass index ideally 18.5 to 25. But if you're above 25, and that's where we come up with 2/3 of America as being either overweight or obese, most people are over that 25 index.
Okay, and another question, I think we have a graphic board we can bring up on this as well, but blood glucose testing as well.
Sure. So the glucose is a spot check, looking for if your sugars are adequate. Also the hemoglobin A1C, which is an average over several months of your sugars. If those are elevated, you need to really sit down with your physician and discuss about how you can change that. Usually diet and exercise are crucial. And what we're shooting for is 150 minutes of moderate exercise or 75 minutes of vigorous exercise per week.
So there's a lot of things that we can do on a daily basis. But then as for those tests, if you haven't started doing them yet, and we just want to recap for you, we have a list of all of those items. So we had blood glucose, we had cholesterol. What else did we have?
Blood pressure is important.
Blood pressure and body mass index. Now, I want to get to just the difference between men and women. You know, often a lot of wives or daughters encourage their fathers, their husbands to go get checked. But what about the women?
So women are always looking out to take care of everyone else for the most part, and they may not take care of themselves just as well. So unfortunately, like we said before, women and men, the #1 killer is heart disease, and they have to realize that. And there's a little grace period. Women will have their first heart attack a little bit later than men, usually at about 72. Men at 65 will have their first heart attack, but they should be monitoring these factors that we just discussed so that they can get a handle on things, so they don't have to treat an existing disease, but prevent the disease, which is far more important.
And just one last quick thing. If you feel like you've been neglecting your heart health, is there anything you can do right now?
Modifying all those factors are always in your power. And if you and the problem that we see is a lot of people are reluctant to take medicines. And if you want to go a little bit further, there are screening tests available to look for those diseases. And if some people need to see that they already have it, and then which is probably not the best way to find out something, but there are screening tests where you can look at the carotid arteries, you can look at the aorta, you can look at the arteries in the legs, and if you see that you already have the buildup of that plaque, that the beginnings of heart disease, the blockages are starting already, a lot of people, that forces them to listen to their physician and start taking the drugs that they should have been taking.
Well, Dr. Salerno, some great advice. Thank you so much. And if you want to see this interview again or for more information, you can head to our website, cbsnewyork.com.